Welcome back to TV5 News at 9. Joining us this morning is Dr. J. Jaganathan, board-certified neurosurgeon and president of Jaganathan Neurosurgery. Thank you so much for being here. How are you this morning?
Good, Colette. How are you?
I'm doing well. Thank you so much. Today, viewers, we are talking about lumbar disc herniations. Let's start off with the basics. So what is a lumbar disc herniation, doctor?
So a disc is basically the padding between two vertebrae in your body, and when a disc herniates, when a disc fragment extrudes into the spinal canal or herniates into the spinal canal, and usually causes symptoms by one of two things: either causes pressure on a nerve, or the abnormalities with respect to the composition of the disc put extra strain on the joints and the tendons in the back, and that can cause pain in the back.
So what are some of the symptoms that patients should be looking out for with this?
Symptoms can really vary in severity. They can range from numbness and tingling in the leg to severe cramping, shooting pains. In extremely severe cases where a nerve is extremely pinched, it can result in weakness, problems of bowel or bladder incontinence, numbness in the perineal or genital area, and so the symptoms can really vary across the board. So lack of severity doesn't necessarily mean that the problem is less severe, but it could be an early sign of a problem that's developing.
But great news, help is available, and for patients, what types of treatment options are available, doctor?
So there are a variety of surgical and non-surgical treatment options. We always recommend a non-surgical treatment. We start with things like rest and analgesics in the majority of cases. And a lot of times that's prescribed by the primary care physician directly. In other cases, things like physical therapy and epidural steroid injections, which are outpatient procedures where some steroid medication is injected around the nerve, are performed. And in cases where the symptoms are refractory, or in cases where there's neurologic deficits such as weakness or difficulty walking, surgery is required. And nowadays the trend towards surgery has been towards using minimally invasive techniques where the recovery might be faster, and surgical results, especially when it comes to leg pain, are usually very good. Back pain is always harder to predict, but with leg pain, up to 80% of patients can have improvement with respect to leg pain. Surgery can be very effective in these refractory cases where other treatments haven't worked.
And patients always want to know, what's the recovery like with this?
The recovery can vary. Usually for a lumbar discectomy where we take the disc out, it's usually an outpatient procedure, or it's an overnight hospital stay. There are temporary restrictions with lifting or bending. As I mentioned earlier, surgery for leg pain is very effective. So for somebody who's got a disc with severe leg pain, who's failed other treatments, surgery can be an extremely good and beneficial option to help them from a pain perspective. But it's always a multimodal treatment technique, which means that we use many sources, myself as a surgeon, pain management specialist, physical therapy, and other things to make sure we find the optimal treatment for a given patient based on their lifestyle, age, and other factors.
I love it. So it's tailored to each patient. So where can more people, so they can get more information about this?
They're welcome to visit our website, mi-neurosurgery.com, or they can contact us at 989-701-2538.
Thank you again, Dr. J. We appreciate it.
Thank you, Colette. I appreciate it.
Of course, you're welcome. You can get more information in the hot link section of WNEM.com.